afternoon, and thanks for stopping by Across the Fence. I'm Keith Silva. Last month, a statement was released from the office of former President Joseph Biden that he was diagnosed with an aggressive form of prostate cancer, which had spread to his bones. The diagnosis came after Mr. Biden reported urinary symptoms. Biden's cancer was scored a 9 out of 10, classifying it as most aggressive. The fact that the cancer had spread to his bones means Biden's cancer is categorized as a stage 4. Prostate is a gland found only in males. It makes some of the fluid that is part of the semen. Prostate cancer begins when cells in the prostate glands start to grow out of control and is the second most common cancer in men after skin cancer. And to talk about prostate's prevention and awareness during Men's Health Month, I'm joined by Doctors Stephen Ades and Ades Lester-Coll. Dr. Ades is a medical oncologist at the University of Vermont Medical Center. He is the medical director of the University of Vermont Cancer Center Clinical Trials Office and a professor of hematology and oncology at the Robert Lawner College of Medicine at UVM. Dr. Lester-Coll is a radiation oncologist and the network chair of the radiation oncology at the University of Vermont Health Network and division chief at the Robert Lawner College of Medicine. He specializes in treating patients with genitourinary cancers like prostate, bladder, and kidney cancers. Welcome to both of you.
Thank you for having us. Happy to be here.
After that introduction, I know I've got the right guys. So let's start. Stephen, I gave a brief definition of prostate cancer, but you're the oncologist. What is prostate cancer?
Well, thanks for inviting us. As you said, Keith, prostate cancer is a disease in men where cells in the prostate, which is a walnut-sized gland in the male reproductive system, grow out of control. And in some situations, that can lead to formation of a tumor and can even spread to other parts of the body.
I suppose if we knew why those cells grew out of control, we could maybe solve prostate cancer. So is there any idea, does medicine have any idea why the cells grow out of control?
Well, we know a lot about risk factors,
Okay.
which we'll talk about later
Sure.
on today, but ultimately it may be a mix of nature and nurture,
Okay.
and living on this planet for long enough. It's a disease of older age.
Okay. How common is prostate cancer nationwide and in Vermont?
So, as you said in your introduction, it's a very common cancer. It's the most common cancer worldwide and in the U.S., and this translates in the U.S. into about 250,000 or 250,000 new cases per year. In Vermont, it's about 100 per 100,000, so it's about 700 men in 2024 who were diagnosed with prostate cancer. So, you know, we always hear the same statistic about 1 in 9 men will be diagnosed with prostate cancer during their lifetime. Another important statistic is how impactful this disease is. It is the second most common cause of cancer death in men, only after lung cancer. So common and important.
Mm-hmm. And before we go too much further, very treatable. One of the things we were talking about before we started.
Absolutely, and we'll talk more about that.
Excellent. Your specialty is prostate cancer, so how often do you see clients with prostate cancer come in, with symptoms?
Right. So the University of Vermont Cancer Center's catchment area is large. It not only includes all of Vermont, but it includes northeastern New York State. And so our multidisciplinary clinics are seeing multiple patients a week who are coming in with a new diagnosis of cancer. Including our urologists, Dr. Lester-Coll and myself. And this runs the gamut from early disease to advanced and everything in between.
Now I'm going to turn to you. How do you get screened, and when should men be screened for prostate cancer?
Yeah, it's obviously a great, important, and timely question. So the general recommendations are men age 55 to 69. Those are what's in our sort of national guidelines. But I think one thing that's really important to think about when trying to make this decision of should I get screened or not is in those guidelines there's a recommendation of what's called shared decision making, and so this means have a conversation with your doctor and talk about your own preferences for screenings. It's more important for some people to know that they might have this diagnosis than others, and talk about the pros and cons, and certainly we can get into that, but the benefits of screening, we want to catch this early. There are potential downsides or what we call harms of screening as well if we're diagnosing cancer that maybe doesn't need immediate treatment.
Okay, and risk factors, genetics, race, age, body type, where do you want to start?
So as Dr. Ades pointed out, this is a disease of increasing age. So age is, one of the number one risk factors. We see this more common in older men. The average age of diagnosis is about 68. So that's why those guidelines are starting in that range of 55 to 69. Family history is very important. So if someone has what we call a first-degree relative, so that might be a sibling or a parent or multiple close family members with cancer, that's considered a very strong risk factor as well. We also know that men of African American race are also at higher risk for being diagnosed with prostate cancer.
So also probably one of those other things that's important for families to talk about, partners, but also about diagnosis or prevention, is also know if it's in your family. Talk
Absolutely.
to your dad.
Yeah, and and it's not just prostate cancer, but other cancers too. There are syndromes that run in families that might put men at higher risk of prostate cancer, but women at high risk for breast cancer. So really just knowing the cancer history is really important.
Dr. Ades, genetics, we were talking about, family, is that a big factor in prostate cancer?
In some men,
men.
Especially not only in first-degree relatives, if you're talking about prostate cancer, a father or brother, but especially prostate cancer diagnosed at a younger age. So younger than 65 or younger than 60, that should raise a flag that you may want to consider screening more seriously and potentially screening at a younger age more seriously. Nat mentioned other cancers, breast cancer, ovarian cancer are big ones, but also colon cancer, pancreatic cancer. These also confer potentially in some men a higher risk of prostate cancer, and then prostate cancer potentially at a younger age.
So certainly if your immediate family, brother, father, was diagnosed with prostate cancer young, under the age of 65, it's definitely something that you should look into as far as, when you talk to your primary care physician.
Right, absolutely. And then the only other thing I would add in this, there are some very specific risk factors related to exposures that we do see in some men, and some men that I have in my clinic, including veterans who were exposed to Agent Orange, which contains dioxin, which certainly has been associated with prostate cancer. And then those men who are exposed to arsenic, usually industrial exposures related to smelting or working in a refinery.
I can speak to the guy sitting on this side of the table. I can't speak to the two gentlemen over there about going for your annual exam. I try to go to my annual exam every 5 to 10 years. Is this something you can be screened at an annual exam? Can you talk to your primary care physician?
Yeah, absolutely. So most prostate cancer screening happens in the primary care office.
Okay.
And that really consists of two things. So one is a very simple blood test called the PSA test. That stands for prostate-specific antigen. And that's just a protein that's made by the prostate. It's a simple blood test. So you might ask, well, it's the simple blood test, why are we only screening within these ranges, and why aren't we doing this more often? The problem is that there are lots of things that can result in a elevated PSA test that aren't specific to cancer. So having a larger prostate for non-cancerous reasons can lead to a higher PSA test, or even something like going on a long bicycle ride and then drawing your PSA immediately after might result in a false elevation. So there's this idea that if we're checking the PSA too often, it might result in a lot of worry and anxiety for something that really may not be related to cancer at all. Right. But having that baseline test is really important, just to know what is your specific PSA and how is it changing over time. And then the other component is a digital rectal exam. So those are the two things that can be done in the primary care office.
Okay. What happens if something is found? What happens if how do you get from found to diagnosis?
Right. So say the PSA comes back higher than expected. Oftentimes what will happen next is repeat the test in a short period of time. Again, there's a lot of things that can falsely elevate the PSA test. And if it's rising or it's higher than it should be, typically what will happen is a referral to a urologist, and a urologist can perform what's called a biopsy. They also may obtain some imaging prior to the biopsy, like an MRI test.
The other thing I keep saying, and we haven't said it enough, is very treatable, which brings us back to the beginning, and former President Biden, not a death sentence. There's as serious as Biden's diagnosis sounds, you can live, you told me, very comfortably and with a very normal life having prostate cancer.
Absolutely. So once you're diagnosed with prostate cancer, your specialist is going to look at all of your information, including the prostate biopsy itself, how much the prostate's involved, how aggressive it appears under the microscope, in cases where imaging was done to look for spread, to determine if it's localized, whether it's regional, or whether it's what we call advanced or metastatic. And then we'll look at the options. And if it's localized disease, and we'll talk about this, one of the options may be to not treat it, because not all prostate cancers need to be treated.
Okay.
And then there are a variety of important local options with curative intent that are addressed. But for a man like President Biden, who was diagnosed with metastatic prostate cancer, there are hormonal and non-hormonal treatments that are all potential effective management options for your cancer. And at least in some, if not the majority of cases, it can be treated like a chronic disease over years and even decades. And so that's really good news for the president, despite the difficult news of having been diagnosed with metastatic prostate cancer.
We've got about a minute left. What do you want to tell me about prostate cancer? What's the takeaway message for you, Dr. Lester-Coll?
As Dr. Ades was alluding to, the outcomes for this are really good with treatment. So I think it's really important to bring that conversation to the primary care doctor. If somebody wants to know, am I at risk for this? Have that conversation. Get the appropriate testing if needed. And then the treatments, whether we're treating for very early stage disease, where, as Dr. Ades was saying, we may not need to do any treatment at all, and we may not need to expose men to the potential downsides of treatment.
Right.
That's totally okay. We can say this is something we can watch and come back to later on. And then we have very effective options for cancer that is not spread, that might involve radiation or surgery, and then Dr. Ades's treatments for more advanced cancer. So there's a lot of options. It's just good to bring these to the doctor's office and have that conversation.
That's going to be our final word on prostate cancer. To learn more about prostate cancer, visit the UVM Cancer Center. The address is on the screen. There's a little code there. You can use your phone to do that. My thanks to the crew behind the scenes here at WCX who make our program possible. I'm Keith Silva. This is Across the Fence. Thanks for being part of our family.